Well, it's kind of funny when you hear the phrase, how do you call 911? You know, because it's like 911, but um, one of the challenges with Decipher Your Health is we want to make sure that patients realize we're just trying to give
Mhm.
information that they still need to have that conversation with their primary care provider. They still need um, to navigate the healthcare system, hopefully with a loved one by
Mhm.
their side. Uh, but let's go ahead and go through how to activate 911 and when you might want to consider it. Do you want to go ahead and tell us that, Marijke? And
Okay.
why we should
Um,
trust you?
why trust me? Okay,
Right.
I used to teach first aid. That was one of the things I used to like doing. And what most of the people I taught were actually usually young grandparents. So they would be babysitting their grandkids. So I used to sit in the front of the class and I'd say, how many of you babysit your grandchildren? How many of you have grandchildren? Most of them put their hands up. How many of you babysit your grandchildren? Most of them put their hands up. How many of you babysit your grandchildren at your children's homes? A lot of hands with what? How many of you know the address? One hand, two hands, maybe. What happens if you have to call 911? What if there's an emergency? And I said, it's very common. You can go to your best friend's house for 25 years and still not know the address because you know where it is. And the same thing happened to me several years ago. A family member had a massive stroke. I found him. I went to call 911. I went, oh, I don't know the address. I had to run to the front door to get the address.
So
Even though
for
I've been
for
saying all these years, know the address, I didn't know the address.
well, don't some of the 911 calls have geolocation these days?
On
It's
landline,
getting better.
it's getting better, but you can't guarantee it on a cell phone.
Right, right. Yeah, because it'll just
So
go to the general area.
so you need to know where you are. You need to have, if you have babysitters or if you have people who are visiting, put your address near your phone or near
Oh,
a
yeah.
central place,
Yeah,
that sort of thing.
refrigerator. I always had that
Somewhere.
to-do list for the babysitter with the
Yeah.
address, our
Can you
phone
imagine how
number.
mortified I felt not knowing the address after all these years of telling people, make sure you know the address?
Well, we are works in progress, as long as we learn. I mean, that's the beauty of learning from your missteps. Let's
Mm-hmm.
not call them mistakes, missteps,
Steps.
because we,
Okay.
it's like constantly doing our little
Right.
experiments, what works, what doesn't.
So the most important thing when I was teaching first aid, I used to tell people, obviously, I want you to remember everything I'm teaching you. But if all you can remember is how to call 911, my job is done because, okay, so first you need to know the address, right? Second, let's say it's an apartment building or an office building, then you need to have somebody to be able to go down to the front door to meet the emergency technicians, right? They're not going to wander around the building trying to find your office or your apartment. You need to
Right.
have somebody meet them. So there's that. If there's pets in the house, no matter how friendly Fido is, he may never have bitten anybody in the world ever. You have to put him in another room because all of a sudden there are these emergency personnel in your apartment or your home, and Fido doesn't know what's going on, right?
Well, especially
So
because everybody's stress level is here and they see
exactly,
their their um,
exactly. So
their
there's all that
friend have
stuff.
the stress. Yeah.
Also, while you're waiting for 911, make sure you have all the emergency information like the insurance card, the driver's license or whatever ID card, medications that the person takes. Try and get them all in a bag, put them together so that you can hand them over to the technician.
Well,
What you need.
let's not forget airway, breathing, circulation. Make sure
Oh
that they're
yeah,
still, you know,
there's that
breathing
too.
on their own. They have a heart rate,
That's
if
right.
they're vomiting, they're in a rescue position on their side so that they don't
But
choke
that's
on
where
their
the
puke.
that's where the the call center comes in great because he or she
Right.
will tell you. I remember when I called for this family member, I said his age, I said what I suspected, a stroke. I told her, I did the FAST, the smile for the face. arms he couldn't lift, that sort of thing.
Oh, the
And
B
then,
fast, yeah.
yeah. So then she said, well, is he breathing? I said, yeah, he's breathing. So she was really, really good, and then I said, I am a
Fantastic.
nurse, by the way, just to let her know that I kind of knew what I was
Right,
going, I
right.
kind of knew what was happening. But yeah, and the other thing is never hang up. Never hang up from 911 until they tell you to.
Yeah.
Because they might need more information. So you
Right.
call 911, you make sure everything's ready for the technicians, excuse me, and then you make sure that the operator doesn't have more information for you,
Right.
and the situation might change while you're waiting. She might say, is he still breathing? Is he this? Is he that? And you have to keep answering, because even if you've never taken a CPR course in your life, you can still do it, just
Right.
and so she
They
will tell
will
you.
coach you through it. Yeah.
Exactly.
Yeah. Yeah.
So calling 911 and knowing how to call 911 is so important. And even something as simple as if you're in a group, let's say you're on the street corner and somebody passes out right in front of you, hits their head. Okay. If you just shout, call 911, everybody's going to look around. I'm going to call. You say, you in the red sweater, call 911 and tell me when you've done. You in the yellow jacket, block the traffic. Okay?
Yeah.
Take charge, because everybody, more or less, everybody wants to help. They just don't know how to help.
Yeah. Have you been involved in emergencies often? Yeah.
Not often, but enough.
Yeah. Yeah. I've been in situations, and it's funny seeing what comes out when you're in that situation. I was in a very busy restaurant and had been craving a Belgian waffle, but hadn't partaken in it my entire pregnancy. And I was 8 months pregnant, ready to pop, and finally sitting down at this huge breakfast place. And this guy walked by, started having a seizure, hit the edge of my table, and fell in my lap.
Oh,
And so, on my nice big Buddha belly, and I'm putting him in rescue position on his side because he's continuing to seize, and he's bitten his tongue, so there's blood going out, and I obviously don't have gloves or anything, so I'm trying to put him in rescue position gently on the ground, and it was just very interesting to see all who came up to offer assistance and what their background was, so I could, tell the dentist, I'm an emergency medicine physician. I think I got this, but assigning responsibilities, the person was smart enough to have a medic alert necklace on. So I did the thing, directed to the waitress, called 911, directed to one person in the place to call the number listed on the medic alert and notify that person that the person, their loved one was in dire straits, and to try and get more medical history for the paramedics upon their arrival. Yeah.
But what's interesting is how we react. When I was pregnant with my first one, I was taking my brother trick-or-treating, and a woman had a cardiac arrest right in front of us.
Wow.
I had worked in the ICU. I knew CPR. I've done CPR more times than I could count. I totally forgot how to do CPR.
It is strange when it's unexpected.
On the street at night, there was somebody else there. I followed his direction. I was so out of my realm of comfort.
It happens sometimes. It's okay to give ourselves a pass. I think, one of the things that they used to tell us when we were going into a code is the word that we use when someone's had either respiratory arrest or cardiac arrest, is to check your own pulse first.
Yeah.
And I guess the way to update that for the 2020s would be to say, do a good serenity breath, in for a count of 4, hold for a count of 7, out for a count of 7, so that you calm yourself down.
Yeah.
Dr. Andrew Weil, who was trained traditionally at Harvard Medical School many a year ago, and lives in Arizona, has done a lot with trying to do not only allopathic medicine, but incorporating non-traditional medicine as well. He talks about the benefits of deep breathing exercises, and was doing deep breathing exercise training for Navy SEALs to help
Mm-hmm.
them get that heart rate down before
Right.
they're asked to do something quite stressful. So
Mm-hmm.
I think the same holds true for those of us in the emergency department, giving us that opportunity to do that deep breath.
Actually, you remind me of something important that I used to say in the first aid courses. A lot of people would tell me, I can't take a first aid course. I panic. I don't know what to do. I say, you panic and you don't know what to do because you've never taken a first aid course.
Right, right.
Even if
Repeat,
you only
repeat.
remember the very basics, at least you'll remember the airway. You know how to check if somebody's breathing. You know what to do if somebody's bleeding. You don't have to do it perfectly. You just know how to react. And the reason you don't know how to react is because you haven't learned.
And you're bringing up a really important point, and now I'm going to get up on my soapbox. Okay.
Mhm,
For all those cardiologists out there who have put patients on blood thinning medicine because
mhm,
they have atrial fibrillation, which is one of the most common irregular heartbeats that exists. It's very
mhm.
common as we age, rare when you're 18, very common when you're 80. Um, you'll be started on a medicine to thin your blood because what they're trying to do is prevent a blood clot forming in the
Mhm.
heart and going up into the brain. I think the other important thing that they need to teach patients and their family members is if the patient cuts their finger, how to apply direct pressure. If their
Yeah,
patient trips and falls and whacks their head and has a big cut on their head, it is going to bleed like blazes. So I
yeah.
feel like there was a really big move for that called Stop the Bleed that came
Mhm,
out a number of years ago. But I think this should be a part of every family's household who is started on that blood thinning medicine,
mhm.
you know, to learn how to apply direct pressure, not for just 5 minutes like we would in a normal person, but for 10
Right,
minutes in
right.
someone who's on a blood thinner,
Mhm,
and if you have heart issues, you should have someone in your family learn CPR, you
mhm.
know?
I personally think nobody should graduate from high school without being to be able to do CPR, but that's a
Right.
whole other thing.
Yeah, I had to get special permission to take CPR classes because my mom had heart issues when I was really little. And they said that you can only take it when you were 16 or older. But my mom had heart issues ever since I was 5, so I got special permission. I remember
Mhm.
to take it early because I petitioned the fire department. Yeah, yeah, but I think that that is so important. If you know that you're at higher risk of falling, making sure that you wear your medical alert bracelet or you have your cell phone on you so you can contact family so that you don't lay on the ground for a
Yeah.
prolonged period of time,
Mhm.
because time is tissue.
It
Yeah,
is. It
yeah.
is.
And I think once again, let's bring up that Decipher Your Health. We're here to help you be able to communicate effectively with your treatment team. That our information here is not meant as medical advice. It's just a method of trying to help you navigate the healthcare system.
We want you to be able to take care of yourself and others and be happy with the outcome, or hopefully happy with the outcome.